depression sufferer, and I'm here to talk with you, and we'll see if something like color therapy, what is that, and could that actually be useful for your depression? So the first thing I want to do is talk to you about where it is, or what it is, where I got the idea from, and then we're going to look at some scientific studies, and then we're going to try some color therapy. What do you think? Yeah, I think that'd be kind of cool, huh? Color therapy is something that I learned from my pain psychologist. I am a real physician, but as you know, nothing that I say here can really be medical advice for you, because you and I have not met in meet space. Our meeting here is a secret, and we don't want all those other evil doctors to know that we're meeting, so it can't be official medical advice. However, I think that we can find good self-care for you. Yeah, that's what I always try to do. But before we get into the color therapy stuff, how are you doing? Yeah. I'm sorry. It sucks. Depression is not fun. And if you have chronic pain on top of it, like I do, or chronic pain kind of causing it, like I do, it becomes the worst. It really, really stinks. It's not enjoyable at all, in the least whatsoever. But there are options. So my pain psychologist, the first one I had, was a really lovely lady, and presumably still a lovely lady. I hope she's okay. She has some health problems, so if you're a praying person and you want to pray for my pain psychologist, you're welcome to do so. And if you're not, you're welcome to not. But she let's see. So she uses this for her patients who are terminally ill, like cancer patients who just have so much pain. And she has found that color therapy is helpful to them. And basically, I mentioned it in my previous video and did a little bit of talking about it, but we didn't really get to spend time on it and really check and evaluate the studies on it, which I'm excited to do with you today. I haven't had a chance to do yet. I just know that she recommended it to me because she said it worked for cancer patients. And what color therapy is, basically, is where actually, I'm going to brush the mic at the same time too. I really wanted to do mic brushing with the last video, but I'm really able to. It is working. Awesome. But my audio all failed. But anyway, what color therapy is using a color and surrounding yourself with a color and then just really focusing in on it so that you forget everything else. And it helps you to kind of forget your pain and kind of get that part of your brain that is focused on pain into something else. And of course, pain can be subjective because it's in your brain. There are pain signals from your body, but your brain is the one that receives and interprets those signals. So sometimes if we can control the brain, we can control the pain. Color therapy is kind of a little hack to do that. So let's try some. But first, let's look up the studies. So what I do when I'm not sure about something or when I want to know more about something scientifically is I go to PubMed.gov. And we're going to look up color therapy. And it's like the first thing that came up. So it's hard to find studies that are really relevant. They have color blindness therapy, but that's not the same. Dental color matching system. Oh, this is important. Complications of laser and light-based devices therapy in patients with skin of color. That's really interesting, but not really what we're looking for. Color therapy here. There's a thing from a nursing journal. It's not exactly what we're looking for. And I figured this. I figured it was going to be fairly difficult to find. Because some of these kind of things are not very, it's like there's something that somebody found out worked, but they haven't done, a really good randomized control trial on it. But I'm finding some, mostly nursing journals. I'm a physician, so obviously I prefer physician journals, but nurses know stuff too. But I'm finding a couple of studies we'll look at. The plebiscite color therapy for environmental monotony and chronic disease hospitals. This looks important. Collective psychology and behavior characteristics, mental and autonomic disorders, and their correction using color and rhythm therapy. That's interesting. Okay. Effects of chromotherapy on cognitive and older adults. That looks fantastic. Naphthalene. Isn't that mothballs with the and non-selective chromotherapy? What is that? I don't know what that is. God, wow, there's some weird stuff here. Alright. The Maharishi light technology with gems. Oh my goodness. There's some crazy stuff here. Okay, you can find some strange therapies. Light therapy for seasonal affective disorder is well known, so we'll probably start there. Non-invasive red and near-infrared wavelength-induced photobiomodulation. That's a different thing. Yeah. Okay. Hair color and psychotherapy will be interesting, maybe. Wow. Okay, so there are some photocolor therapy. There are some studies. There are a lot of studies. We found some. Good for us. Color analysis. So I guess it's usually called chromotherapy, which I didn't know. Alright, so let's look through some studies. The first one that I found is just the first one I found is useless. Looks like it's just an article in the Florida Nursing Journal in 2000. It doesn't have any information, so we're not going to go there. Here we go. There's an art therapy journal in the Yonsei Medical Journal. That sounds like it's in Korea. It is in Korea. It's from Dr. Mi Kyung Kim and Sun Dong Kang. And their study is this is in the journal, and you can look these up on PubMed and look at them yourself and evaluate them if you like. It's the Journal of Yonsei Medicine, 2013, January is when it was published, and the article title is The Effects of Art Therapy Using Color on Purpose in Life in Patients with Stroke and Their Caregivers. And the abstract says, patients with stroke suffer from physical disabilities followed by mental instability. The caregivers also suffer from mental instability. The present study attempted to address the degree and change of the level of purpose in life in patients with stroke and caregivers by applying art therapy using colors. So they had 28 stroke patients and 28 caregivers. So it's a small study, right? We call that a very small N, which means that it's not as valid as a much larger study, but you work with what you have. And the period between the stroke and the color therapy was more than 6 months. That's important. Patients and caregivers were divided into color therapy and control groups. So that's important, right? You have to have a control group for a good study. That's what makes it a randomized control trial instead of a like a case study series, which is less good level of evidence than a randomized control trial. A questionnaire which measures the level of PIL was conducted separately. So they did this questionnaire, and they found a significant difference before and after color therapy with the level of PIL. They were the same between the color therapy group compared with the control group. The significant difference was the same in both patients and caregivers. As color therapy progressed to the late phase, patients and caregivers applied increasing number of colors and color intensity. That's interesting. So they say their results prove the color therapy will improve purpose of life of the patients with post-stroke disability and caregivers. Furthermore, color therapy would be a useful adjuvant for improving the quality of life of the patients with stroke and their caregivers. And actually, they have the entire study is free to read, so that'd be a good one to read, right? It's only 28 people times 2, because it's the patients and their caregivers. So it's not they recognize the limitations of their own study. They say that it's an adjunct therapy. It's not like we're going to be like, this is going to cure your stroke. They are very limited in the claims they're making, and they're keeping the claims they're making to the actual results that they found. And I always find that really respectful and awesome when people do that, who are doing small studies, right? So that's kind of cool. So that's neat. What a neat study. Okay. And then the mechanistic basis of chromotherapy is in the Journal of Complementary Therapy Med Journal. Its shorthand is Complement Ther Med, so I don't know the full. I'm not familiar with this journal. This is only a review article. This is not a study. It's published 2019 October, and it's called The Mechanistic Basis of Chromotherapy, Current Knowledge and Future Perspectives. So when you're researching a topic, a lot of times it's a good idea to read the review articles first if you're going to read the whole thing, because they link to all of the actual studies, and it's somebody's analysis for you of all these things. However, a review article isn't, it's okay to cite that if you're doing, like a magazine article or something like that. But for actual studies, like an actual, if you're actually writing a scientific paper, you want to cite studies, not review articles, right? Because review articles are secondhand information. The study is firsthand information. But it's definitely interesting for somebody like us who's looking to try to understand just generally about this topic. A review article is really great. And so what they say, right, they define it. They say chromotherapy is a method of treatment that uses wavelengths in the visible region for curing different diseases and medical conditions, right? Recent advances in photobiology and the specialty of photobiomodulation are uncovering the cellular and molecular effects of visible range electromagnetic radiation. So they're really emphasizing how this is affecting cells, and they're looking at how the visible light affects bacteria, enzymes, wound healing, psychiatric diseases, other kinds of things like that. They highlight the correlation of wavelengths used between recently uncovered mechanisms of photobiology and conventional chromotherapy, right? So these are a lot of really big claims, and obviously I can't, we're not going to read the whole review article right now. So this doesn't tell me either way, like if this is a real thing. The other study actually does give me information to let me know that, well, for those 28 stroke patients, they felt better after doing some art and having some colors. And it made them feel more purpose in life. And to some extent, I don't even need a study to tell me that, because I anticipate, like everyone knows, art has that effect on people. So, that's a useful adjunct to improve your quality of life, right? So thinking about what colors to put around you is going to help you a little bit with your depression, and for 2 reasons. One, because it's going to get your mind off of the things that are cycling in your depression. 2, it's going to force activity. So actually 3 reasons, because I have one more after this. 2, it's going to force activity, because remember, I've said before, the opposite of depression is not happiness. Happiness is not found via therapy. The opposite of depression is activity, because depression ultimately becomes an energy disorder. It's not just being sad, it's when you are so sad that you meet all of the criteria in the DSM-5 because you can't do stuff anymore. You are so drained. You become very slow, you have sleeping issues, you have eating issues, like your normal biological processes become altered by this mood decrease. That's depression, right? And we've talked about that in our first visit. So this is interesting, but putting colors around you can kind of help you to be doing an activity thing, right? You're doing an action which kind of kicks you out of where you were with the depression. Another kind of important thing to think about and consider is that, is the effect of color therapy itself, right? If colors do have some kind of impact on the cellular level or so forth, and that I haven't seen any evidence for yet, but we also are just getting started. That could be another way in which it's benefiting you, right? But the ways in which we know it benefits you, I've mentioned. To have good color around you. And there are so many architectural studies that focus on this. So in medicine, this is something that's not very well understood because we really rely on randomized controlled trials. But in architecture, color is so important, and color psychology and how people behave and how you want people to behave. Modern architecture that's more human focused really thinks about these kind of things. So that's not unusual. It's not an unusual thing to think about. So anyway, there's that review article. This study, unfortunately, we don't have any. Oh, this is interesting. There's a study on the anti-nociceptive effects of color polarized light in animals with a formalin test. And that's the other thing is, you also want to look at what the kind of study it is and what journal it's in, right? If it's in JAMA, that's a major journal, which is heavily, checked. I don't want to say censored, but all of everything is, there's people be checking to make sure that that's there's multiple levels of reviewers. That's a heavily reviewed article, so for every article that goes in there, so you can kind of trust it a little more. I don't know what this one is. This one looks like it might be a German article. It's the journal of it's a Ukrainian article. It's the journal of Physiologichny Journal from Kiev, Ukraine. This is 2009. I'm pronouncing that terribly, but the shorthand is FIZIOLCH.2009. Anti-nociceptive effects of color polarized light in animal with formalin test. And they wanted to see what light changes, if that changed animals' pain. This is kind of a mean study. The red light was most effective for pain, behavior, depression. Analgesia averaged 64.1% and 54.4%. How interesting. This is on animals. Wow, what an interesting study. Formalin-induced pain behavior, licking of the painful area, was tested in control mice and mice exposed to one of the color of P light, either red, orange, yellow, green, blue, or violet on the painful area. Exposure of the painful area evoked a statistically significant decrease of the licking time in mice. Wow, to 31 to 64% and 31 to 54% respectively. Wow. The red light was most effective for pain, behavior, depression. So that's interesting. So maybe I should surround myself with red. The analgesic effect of red light compared to three cold colors, blue, green, and violet, and white light was more pronounced in case of its application on the painful area than on AP. In conclusion, the intensity of analgesic effects of P lights strongly depends on its color. We don't know how many mice they used. This is just an abstract, and I don't know if we can get the full text. We can't get the full text. So I have to take everything with a grain of salt. I don't know how many mice they used. I can't access the full text, so I can't really, like with the Korean study, I could go through and actually, if you wanted, we could actually go through all the results and nitpick all the different kind of statistical anomalies, but with this one we can't do that. It's still very interesting conclusions that they've drawn. I take everything with a grain of salt, right? But you see, there's some basis for this. It's not just totally woo-woo. Color therapy in hospitals. The nursing journal is not available. Oh, this is an interesting one. 116 patients were divided into 4 groups, 3 experimental groups and 1 control group. The first 3 received, so they were testing color therapy, rhythm therapy, and transcranial magnetotherapy, which is a new kind of therapy where they put magnet waves at your brain to try to help you with your depression or with brain stuff. And now this is interesting. This is an interesting study. And we'll probably stop here because it's getting long, and we'll do some color therapy stuff. But this study is really neat. This is in the Journal of Neuroscience and Behavioral Physiology. This was published in 2010, and they took 116 patients, 3 experimental groups, 1 with each one. The first 87 patients in the first 3 groups received transcranial magneto and or color and rhythm therapy along with the traditional treatment, while 29% received basal treatment only. So of course they're giving all the stroke patients this is another thing, like these studies are ethical, right? They're giving them the gold standard recommended treatment while they're not stopping doing that to try color therapy, because that would be and some alternative medicine is really shady because of that, because they're like, let's stop doing, the medicine that we know scientifically to be true, in favor of doing this thing instead. You want to go with the evidence. If the evidence leads you to color therapy, that's good. If you want to go with the evidence, you don't want to just, abandon all reason because a new idea or a new therapy came out. I think we have a tendency to be anti-science sometimes. Not we, but I was at a church once where somebody said that they didn't need the Hadron Collider because they had Jesus. And my thought is, couldn't you have both? Not to offend anybody here, not to offend you. Yeah, I know you and I believe different things, and that's okay. I just think that it's really important for your healthcare to try to have, a scientific basis in the things you do. I think it's also important to try new things. So, right, if you've tried a lot of things, why not try color therapy, right? It's not going to harm you. It doesn't have bad side effects. So, anyway, they did this study, and it talks in detail about which hertz they use, what modulation frequency they use for the transcranial therapy. And then the color therapy, they had an alternating scheme of stimulation of the left and right eyes with green and or blue light with a period of 2 to 4 seconds and an on time of 1 second. Each of the 3 experimental groups received 2 courses of treatment separated by 1.5 months. After treatment, all experimental groups, particularly group 3, showed more marked improvement than the control group. Wow. That's really cool. So the best result on all measures were obtained in patients given the combination of transcranial therapy and the color therapy. Transcranial therapy had greater influence on hemodynamics, while CRT had the greater effect on psycho-emotional status. Both treatments were well tolerated and produced no side effects. That is a cool study. I get excited about this study because they go in real detail. Even in the abstract, they go in all this detail about exactly what, because that's a problem with some studies, especially on alternative medicines. They don't tell you what dose they gave. They don't tell you, what formulation exactly. And that's not a good study. This is 116 patients, and they had 4 groups. I mean, this is a super randomized controlled trial. Like, how sexy is that? Oh my gosh. Dr. Sholomov and Dr. Shirevashenko and all you Russians. Whew, you got me getting my motors turning. I might cry. And there's a link to the full text so you can go through all the little results. Oh my gosh. I'm really geeking out right now. I love biostatistics. Oh. I love science. This is a good study. This is a fantastic study, and it's a good study on color therapy. We're going to stop there so we can actually do some color therapy. But damn, son, that's... I apologize. I'm getting excited. I found like 10 other studies and chapters and things, but by far that's super cool. Wow. There's one that has a really weird title: Color Therapy is Applied with Paint. Sounds like... yeah, okay. I believe you, dude. Let's play with some colors. We did this last time and we didn't get to really get into it. I'm actually going to pull out my little nebula cards. And I've done this with you before when we did the Space Woman video. And I want to... This could be why you feel good after you watch ASMR that has tracing and different colors. It could be because it's in, color therapy is being involved. It could also be why Gentle Whispering's videos on choosing people's colors are so effective. So, We talked about red for pain. This is a nebula. Can you see it? Can you see this nebula? I think it is NGC 2346 planetary. Can you see it? Let's find a prettier one. That's nice and red though. Some of these galaxies and nebulas are really pretty. When my book comes out, I hope that they put a lovely nebula on the cover. This is the the Eugene Nebula. Oh my gosh. Why they have to do that to me? Just kind of dive into the red. Focus on the red. Get really into the red. Just focus on the red. Imagine diving into the nebula. Some of these are dumb. Not that a nebula can be dumb, but I don't really care about Saturn. Also, I already know that Saturn is the 6th planet from the Sun. Like, how do you not know that? Oh, this is a weird one. The Trifid Nebula. Looks like a butterfly. Can you see that? Oh, this is unfortunate. I feel like you really can't see. I'll have to use a different. Look at that. It's got those little horns. Can you see? Oh man, I think you can see. Let's look at something other than cards then. I think there's a crab nebula in here that I really like. Look at this nebula. Oh my gosh. That one you can see. Isn't that beautiful? It's a helix nebula. 4. It's backwards for you. Look at that. That's super rad. Oh, cool. Space is beautiful. This is the sun. What a pretty picture of the sun. This is a NASA picture. It's so like red. Our sun is technically a yellow sun. It's not a red giant. But here it looks very red, doesn't it? Yes, Superman's planet has a red sun. Did you know that? Speaking of Superman, let's spend some time with... A lot of you didn't, because of the bad audio quality on my pain psychology video. You didn't get to really enjoy my Superman painting, which I didn't know was Superman. I was a little horrified to find out. Not that I have a problem with Superman, just that I didn't know we'd murdered him. So this, I'll show you what I'm talking about in a second. Just a second. First, let's look at dragons. I want to get these flowers out of the way. I should probably put them in a different box, because they're in the way of the painting here. I have a painting here about a dragon, and I have all these dried flowers that are left in the painting. Look at that beautiful dragon. I bought this at Armadillo Cove one year. I didn't sell very many books that year. I bought a lot of art. This is by Rachel Mayo. Rachel Mayo. I guess you can find I promised you Superman, did I not? So the title of this piece, as we discovered last time, is Superman Deconstructed. Let's take a look and we'll get into these pictures. Let's follow the red. Last time we followed the blue. And of course what I'm doing is terrible. You should never, ever, ever run your finger on a real oil painting. Actually, this is acrylic, but still. This is a very naughty thing to do. Follow this red. It's just, if we call it Superman Deconstructed, it makes me think like we literally squished him, which makes me feel bad, poor dude. I like Superman. I identify more with Batman, but to tell you the truth, I think Superman is a better hero. He's a nicer person. He also lost his parents, but he doesn't spend his whole time whining about it. But Batman is more depressed, so I understand him. Look at that. Just follow the red. This is so bad to do to paintings. I am so evil. Evil. Just gonna dive in it. All up in your eye. So what was interesting between those two studies is the red light for the mice was shining on the mice versus the lights that this other study was doing for therapy was blue and green shining in the eyes. So obviously there's different effects, right? So what my pain psychologist told me to do is find a color that makes you feel better when you look at it and put that color around you. So, because I don't know that, well, we haven't found a study yet. We've only looked at a couple that lets you know exactly what color you should choose. But yeah, neat, huh? This is cool. So next time, I think we'll look up studies on journaling and anxiety, because we didn't get to do that. So we'll keep trying to find ways to get better from our depression, right? So there's no handout this time, because the homework for you really is to try color therapy. Try it on yourself. Do it. I really, really want you guys to actually try these things in real life. I bet slime would be good for color therapy. I have slime here. But we really, really need to go to bed, because I have many, many more of these to do with you. And I have to